Welcome back to Open Line. Thank you for joining us. My guest tonight is Dr. David Aronoff from Vanderbilt University Medical Center, who is an infectious disease specialist dealing a lot with COVID-19 right now. And it is your chance to ask your questions of him. 615-737+ is the number to call. And we do have some callers on the line tonight. Linda is on the line. Good evening, Linda. Go ahead with your question.
Okay. Thank you for taking my call.
Sure.
I have a statement and then I have a question about the vaccine. Our governor doesn't seem to be doing hardly anything. He is so on and off about everything. What's it going to take to get him aboard? I mean, we have more infections in Tennessee than anywhere else in the world per capita. And on the vaccine, if you're lucky enough to get it, when you get your other injection, 3 weeks later, are we going to be assured that we'll have the one we need? I know they say you have to take the same on the second one as the first one. And are they taking any precautions to reserve some for the people that get the first one?
That's a great question. Dr. Piercy addressed that today in her news conference, so you might also want to read up on that or rewatch it. I'm sure we have it posted on Facebook or online as well. So Linda, look into that. But Dr. Aronoff, I would love to hear what you have to say.
Yeah, thank you very much for your question. Linda, the point you made about disease activity is really good. Tennessee for the last few days has been the most active COVID hotspot in the United States. If we look at the number of cases that are being diagnosed per 100,000 people per day, and that's why we're seeing our hospitals filling up with COVID patients. That's why we're seeing deaths at the rate that we're seeing in Tennessee from COVID-19. And I think vaccine really can't get here fast enough. It really is a bottleneck based on manufacturing. My understanding, and I didn't have a chance to see Dr. Piercy's press conference today, but the planning for distributing either the Pfizer vaccine or the Moderna vaccine is absolutely based on making sure that anyone who gets a first dose has a second dose available. The way the trials were done, it turns out that Pfizer wanted to wait 3 weeks between the first shot and the second shot to get a boosted immune response, and Moderna designed their trial with 4 weeks. Essentially, they're really almost identical vaccines. And I think that difference of a week doesn't make a huge difference in the efficacy. As you saw, each vaccine's like 95% effective at preventing infection. We don't really know if you get the Pfizer vaccine first that it's a bad idea to get the Moderna vaccine second, but that's not how the trials were done, and that's not how the FDA evaluates these. And so they authorize the use of sort of staying in your lane. If you get the Pfizer one first, you get the Pfizer one second. If you get the Moderna one first, you get the Moderna one second. And I certainly think that's the best approach, and it's easiest for keeping track of who's gotten what also.
And I think in a nutshell, Dr. Piercy said today that the government, the federal government, is holding the second doses right now, and they have assured the state that those will be sent in time and with the quantity that is needed to give the second doses. So she said that is where they are with their understanding right now on the issue. Let's get to Michael, who is on the line. Michael, thanks for being with us. Go ahead.
Hi, Dr. Aronoff. My question, you mentioned high blood pressure. I would like to hear a little bit more about the relationship of COVID to someone with high blood pressure, and especially for those of us who do have it but are trying to control it with medication.
Great question. Thank you, Michael. I'm going to hang up so you can listen to your TV. It makes it easier. Go ahead, Dr. Aronoff.
Yeah, so this virus, the SARS-CoV-2 virus, doesn't just have the ability to infect our respiratory tract, like our nose and throat and lungs, but it also has the ability to attack our blood vessels, which control our blood pressure. And for reasons that are not completely understood, having high blood pressure is absolutely a risk factor for doing poorly with COVID-19, particularly in the hospitalized patients who I see. It is very common to see high blood pressure as a diagnosis like diabetes that can go along with people who get very, very sick. We certainly think that for people who have either diabetes or high blood pressure, keeping those conditions under good control is helpful. It's helpful for lots of reasons, controlling high blood pressure, reducing the risk of stroke and heart attack and other reasons. But we also would really advise people during this pandemic, if you have a medical condition, particularly one that's been associated with doing poorly with COVID-19, that you talk to your licensed healthcare professional, make sure that that is being managed to the best of your ability, which we think will stack the cards in your favor in case you were to get infected.
Great advice. All right, Diane is patiently waiting. Diane, you're up. What's your question tonight?
My question is, with all the patients dying from COVID, what are they actually treating them with? Are they using the remdesivir?
Okay, good question. What are you treating patients with, Dr. Aronoff?
Yeah, so a couple things to say. First of all, thank you for that question. The treatment is complicated. First of all, we provide supportive care. Often these patients need oxygen. So we give people oxygen, we give them intravenous fluids if needed. And then if somebody is in the hospital requiring oxygen, there are a couple of now standard therapies. One is the use of steroids in the form of dexamethasone, which is called a corticosteroid that's been shown to improve survival in patients with COVID-19. And the other is the antiviral drug remdesivir. And that drug has been shown to accelerate recovery and possibly to improve survival. We use both of those medicines quite often if somebody is hospitalized and requires oxygen. What we learned from the clinical studies, and what is certainly my experience in the hospital, is that these are not miracle drugs. They don't cure people who have COVID-19. They help some people get better, but there are still people who get sicker despite our best therapies. And we unfortunately see people require life support and die from COVID-19. In the United States now, we're seeing about 2,000 to 3,000 people a day dying of COVID-19. In Tennessee, it's around 100 people a day dying every day. And it's not because they're not getting treated with dexamethasone and remdesivir, but it's that this can be a very a dangerous infection that can be unforgiving despite best efforts.
Have you learned so much about this from the beginning? I mean, treatment has certainly changed.
There is so much I've learned about this, and we've all learned as we've gone. I had no idea that we would have a respiratory tract infection that could spread so rapidly in the absence of symptoms. This silent transmission, I wish I had known about this even earlier than we found out about it, because I think we could have saved even more lives had we known about that earlier. Obviously, we're learning what therapies work, what therapies don't seem to work. We're learning to look for complications like blood clots, which we really, didn't appreciate until we really got into this pandemic a bit more. We've learned about the importance of social distancing and face masks and things that were just not part of our behavior prior to 2020. So every single day, I'm learning something new, and it's a really humbling infectious disease.
Wow. Let's try and sneak in one more phone call here. We have Tom on the line, then we'll take a quick break. Tom, go ahead.
Hey, good morning, Tommy. Good evening. How y'all doing?
We are doing well. Go ahead.
Good.
Okay. Yes, I got one lung removed, and I have fibrosis in the other one. And I'm skeptical about taking this vaccine because it's put out here too fast. And like I say, they sent it over to the UK. They started using it over there first to see how it's going to work. But then there's been some issues coming up that really concerns me about taking that shot. Would it be dangerous for me to take that shot? Or is that shot supposed to help me in my condition?
Okay, that's a great question, Tom. I'm going to hang up. I want you to listen to your TV so you hear this answer. Thank you for calling in tonight. Dr. Aronoff, go ahead.
Yeah, Tom, thank you so much for that question. Without a doubt, you're exactly the type of person that would benefit from this vaccine. You have reduced reserve in your respiratory system. You really can't afford to get a serious life-threatening respiratory tract infection like COVID-19. It could be incredibly dangerous for you. The vaccine is not a live virus. It doesn't cause COVID-19. It is very, very safe. There have been a small handful of patients who have had serious allergic reactions. I think There have been somewhere around 6 of these to 9 of these, with hundreds of thousands of doses of the vaccines being given. And we've learned a lot about what that allergic reaction may be to in the vaccine. And we know how to identify people. And when we give the vaccine to someone who's had an anaphylactic reaction in the past, for example, we monitor them for 30 minutes and watch them very, very closely. I would absolutely say to get this vaccine. It is definitely going to save lives. I mean, there's just no question about it. When we look at the Moderna vaccine trial, for example, there were something like 30 severe cases of COVID-19 in that study that put people in the hospital. All of those cases were in the placebo group. None of those cases were in the vaccine recipient group. I just got my vaccine. The vaccine causes some arm soreness. It can cause temporary fatigue, headache, muscle aches, fever as well. And those are your immune system reacting to the vaccine, which is exactly what they should do, because you want to mount a strong immune response so that if you were to get infected after getting vaccinated, you would not get deathly ill. So thanks, Tom, for that question. That's a really important one.
Okay, we're going to take another quick break. More questions when we come back. Stay with us.